So how do you know if you have an eating disorder? Let's figure out what they are first, and then maybe some things that you can do to find out. So in an earlier life, when I had a traditional psychotherapy practice, I got to work with all kinds of different diagnoses and conditions, and part of that experience, I got to work on an eating disorders unit in an inpatient psychiatric setting for eating disorders. And I learned a lot during that time. First of all, I gotta tell you, just from a personal standpoint, one of my dear friends, when I was back in high school, was hospitalized for bulimia. I didn't even know what bulimia was at the time. And I did a little searching and figured out, this is what they call an eating disorder. Now, I had never encountered one of those before, but this friend, as I went to visit her at the hospital, opened my eyes to something I was never even aware of before. And I got to visit not only her, but I got to sit in on some group therapy sessions. I got to experience what treatment is like for eating disorders. And it was shortly after that I changed my major to psychology. I actually started school in chemical engineering as my major. And that's because back in high school I had great grades and I was really good at the math and science. And what do you do as you come out of high school? Well, you go into engineering. I didn't have any passion for that. But as I had this experience with eating disorders for the first time, that was really my first introduction to clinical psychology. And it turned my brain on about some ways that I might be able to assist people in a way that would be so meaningful to me later. So doing this video is kind of a fun little flashback for me. Even though I don't work with eating disorders routinely anymore, I've got that experience and I've got a soft spot in my heart for those who are suffering from eating disorders. Now, the two most common ones, or the ones that we most commonly associate with eating disorders, are called anorexia and bulimia. Sometimes anorexia nervosa is the full word that you'll hear, or bulimia nervosa. But that just has to do with the neurotic element that's attached to the eating disorder. And they both have to do with disorders that have become so prevalent. Some of the estimates out there place the number at upwards of 20 million Americans who are afflicted by some form of eating disorders. And there's others besides anorexia and bulimia, but we'll talk about those two mainly today. And I think part of what I want to do is just raise some awareness so that we know what this thing is. In fact, I've grabbed a copy of the Diagnostic Criteria that I can share with you. This comes from the Diagnostic and Statistical Manual of Mental Disorders. And this is basically the Bible of diagnosis for the fields of psychiatry and psychology. These are the disorders that are recognized by the professional industry. And so looking first at anorexia, there are three primary symptoms that we're looking for, or diagnostic criteria is a better way to describe that. The first one is restriction of energy intake relative to requirement. Don't you love the way they word these things? Basically, all it means is you're not getting enough fuel. Okay? You've got to have a certain amount of fuel to survive and to thrive. In anorexia, there's a restriction of the fuel intake, typically food. So that usually manifests in a very significantly low body weight in the context of age and sex and stage of life and things like that. And an intense fear, this leads to the second one actually, an intense fear of gaining weight or becoming fat. And can I just tell you, the distortion in this fear hits levels that you can hardly even imagine. I taught a course in abnormal psychology for a few years at one of the local universities. And I used a textbook that had an image in it of a woman who was severely anorexic. She was, I don't even remember what she weighed. I think it was in the 80s. Okay, not 180, 80 pounds. An adult woman. This is not enough weight to support life. And in this picture, it shows just how emaciated and thin she is. But to ask her, what is her problem? Oh, I'm just so fat. Look at these thighs. I mean, things like that are the descriptions. So the self-image is very, very distorted. She, in this textbook, was actually at a point of near fatal conditions in her own body. Because when this gets severe enough, there's a condition called hypokalemia, for example, and that's when there's a deficiency in some of the minerals, specifically potassium, that your heart needs to function. And when you get that deficient in it, you can have heart failure just like that. In a person who's young, and shouldn't be experiencing heart failure. But this is some of the severe consequences that can happen. The third criterion for anorexia is a disturbance in the way in which one's body weight or shape is experienced. And I just gave you a good example of that, because even though anyone who you would ask to observe her and comment about her weight would say that she is underweight and probably severely underweight, her own perception is exactly the opposite. And she thinks or believes that her problem is that she's too fat. So how do these distortions happen? Before we go into the diagnostic criteria for bulimia, I'll share those with you too. I just want to comment about that because I had an opportunity on my podcast just maybe 2 months before he passed away. I got to interview Ron Zeller, who is a world-class leadership trainer and coach and an inspiring person in my life. And Ron agreed to an interview. I went and visited with him in his home. And as I entered his home, Ron asked me, he said, "Paul, how old are you?" He calls me Polly, actually. He's one of the only people in the world that calls me Polly. I thought that was a parrot's name. Anyway, he said, "Polly, how old are you?" I'm like, and I'm joking with him, right? So I said, "Well, my twin sister just turned 50. And he laughs, says, "That's really funny. But what you're talking about is the chronological age of your carbon-based Earth suit." I'm like, "What do you mean?" "Your body is 50 years old. Is that what you're telling me?" That wasn't my question. I asked, "How old are you?" Ron's whole point was that I am ageless, okay? Because he has a belief that there's a soul or a spirit inside of people that is ageless. And that soul or spirit is you. And you have a body, but you are not your body. That's why he called it your Earth suit, which was kind of interesting to think about. But that's one of the problems that I think comes up in a typical eating disorder, because we identify so much with this body that we start to think that this body is me, when really I'm inside of here and you are not your body. Consider that for a minute, just see where you can go with it. That's for your Gee Whiz collection. Let's go on with the eating disorders for a moment. Diagnostic criteria for bulimia. Again, from the DSM-5, recurrent episodes of binge eating. Now, some of you are already nervous because you're like, "I binge all the time." This gets to be really severe. When I was working in the hospital, I heard all kinds of stories about some of the binges that can happen. We're talking like a full half-gallon of ice cream in one fell swoop. A complete box of donuts. Do you see what I'm talking about? I'm talking an extreme kind of a binge. And then number 2, recurrent, inappropriate, compensatory behaviors. Who writes this stuff? These are just big words that says, look, once they binge, they then try to counteract the binge with some kind of a purge. That's what it means by compensatory behaviors, like vomiting, use of laxatives, fasting, excessive exercise, because what they're trying to do is prevent the weight gain that's implied if I binge eat. So it's this cycle of binging and purging, and that has to occur regularly, at least one time a week for 3 months in order to make the diagnostic criteria. And then number 4 is similar to what we heard in anorexia. There is a self-evaluation that is unduly influenced by body shape and weight. And number 5, the disturbance does not occur exclusively during episodes of anorexia. So in other words, if you're seeing these behaviors, but you already meet the criteria for anorexia, then they're going to give you that diagnosis instead of bulimia. Now, why did I share these criteria with you? I think information and knowledge are potential power. Knowing that some of your own behaviors or someone that you know, because you're watching this video for a couple of different reasons. Either you're a raving fan of Dr. Paul, in which case, thank you, I love you. Or you found this video because you're interested in anorexia, bulimia, eating disorders, and you might be concerned about yourself or someone else. How can you tell if you've actually got one of these disorders? Here's a couple of things to pay attention to. The diagnostic criteria can be a guideline. And those are there for professionals to know how to accurately diagnose the condition. If it feels to you like some of those might match with you or that person that you are concerned about, there are so many resources now available online where you can do a little quiz or a self-assessment. Now, a little word of warning about some of those. Some of them are supported and provided by service providers who want you to come to their facility for treatment. I just want to give you that little flag because it doesn't mean that it won't be useful to you to go through the self-assessment, but it will probably put you into a sales funnel where they may want to get you into their treatment program. Just be aware of that and then use it to your advantage. That there are these assessments available, because it will give you a sense of how does my particular situation compare to something that might be clinically indicated, through those criteria that I shared with you. How does it compare? And you'll get a little bit of a sense that way. There is so much help available, and it's important to get the help that you need, because this is not a light issue. This is something that needs to be taken very seriously, because lives are lost to these disorders tragically and unnecessarily. There are so many good treatments available that it would be unwise to not take advantage of those treatments, and I would strongly encourage you to do that. If anything that I've shared with you today about eating disorders sounds familiar or like something that might apply to you or your loved one, please take that next step. Every community is at least close to some kind of great help. So do some searching and researching in your own community, find out what's available, and let's spread the word about some disorders that unnecessarily take people out of the game, people who are amazing and can contribute some wonderful things to all of us. The bad news, this is a really prevalent problem. The good news, there is so much that you can do. And I bet you know someone who could benefit from this information. Please share this video with them.